Hi, my name is Lauren, and on this slide we're talking about the differential diagnosis for diabetes. Because the diagnosis criteria is the same for both type 1 and type 2 diabetes, it's important to distinguish between the two. This distinction can be difficult in the pediatric population and in older adults with latent autoimmune diabetes of the adult. Factors such as age, ethnicity, obesity, and family history can aid in identifying which type of diabetes the patient has. Other tests include the zinc transporter 8 antibody test. This is used to diagnose type 1 diabetes and is the best way to distinguish between the two types. Another test involves measuring C-peptide levels. This is used to determine the extent of beta cell destruction, which is seen in type 1 diabetes. Furthermore, type 1 or type 2 diabetes should be differentiated from specific types of diabetes like gestational monogenic diseases of the exocrine pancreas, such as cystic fibrosis, and drug or chemical-induced diabetes. The liver also has an important role in maintaining homeostasis of glucose metabolism. Hepatic dysfunction and liver dysfunction or liver cirrhosis can lead to the development of diabetes mellitus. It's important to differentiate between this hepatic dysfunction and type 2 diabetes in order to give the appropriate and individualized treatment required. Additional differential diagnosis involve the various symptoms of diabetes mellitus. In pediatric patients who are experiencing diabetic ketoacidosis, the resultant Kussmaul breathing patterns may be misdiagnosed as respiratory infection if type 1 diabetes was not previously diagnosed. Peripheral neuropathy in patients may be attributed to other causes if a diabetes diagnosis wasn't previously established. Peripheral neuropathy can be caused by hypothyroidism, nutritional deficiencies in vitamin B6 or B12, and various drug toxicities such as chemotherapeutic agents, anticonvulsants like Dilantin, heart or blood pressure medications like amiodarone and the statins, and some antibiotics as well. Finally, diabetes mellitus should be ruled out when a diagnosis of metabolic syndrome is made. Metabolic syndrome can accompany a diabetes diagnosis as it is associated with insulin resistance, but it can occur in patients with normal glucose levels, prediabetes, and diabetes mellitus.